Is there any connection between strokes, heart attacks, and cholesterol?
Well, in my opinion, no. And I say this because we go back again to 1990, the introduction of the statin drugs. At that time, heart disease, heart attacks and strokes were the number 1 cause of death, followed by cancer #2. And they were up around 37%. So here we are, 25 years later. And with half the population that's over 50 taking statin drugs, we look at the numbers again, and heart disease and strokes are still the #1 cause of death at 35%, followed by cancer. So we have a 2% reduction in 25 years, which is mostly due to people who have quit smoking. So if those are the statistics, those are the facts. So the question is, how can you determine that statin drugs are going to prevent heart attacks and strokes if the statistics show they haven't done that at all?
So in your opinion, when you weigh the benefits and risks, because we always hear this from the doctors, what are the benefits, risks, how do you think about that?
Well, to me it's obvious that lowering your cholesterol levels has absolutely no benefits, because you're not preventing heart attacks, you're not preventing strokes. Risks are huge. You're going to give yourself pain, you're going to give yourself muscle pain, you can cause kidney damage, you can give yourself diabetes. And not only that, by lowering your cholesterol severely, you very well you can be setting yourself up for dementia or even Alzheimer's disease.
I remember reading it, so what's the percentage of the brain that's made up of cholesterol?
Well, actually, most of the material in the brain is made up of cholesterol. But that is not the cholesterol that we measure. We wouldn't even have a statin drug unless they discovered years ago that you could measure cholesterol in transport. And that means the cholesterol that's in your bloodstream. So that was what they could, so when they tell you have a high cholesterol number, that's not the amount of plaque you have in your arteries, that's not the amount of anything accumulating anywhere. That's an amount of cholesterol that's traveling through your bloodstream on its way to do things. So it's almost meaningless.
Interesting. If there's no history of heart disease in my family or in myself, do I have to lower my cholesterol if my physician says it's too high?
In my opinion, absolutely not. There's no point. Again, if we talk benefits and risks, what are the benefits? There are no benefits. What are the risks? They're huge. It's unfortunate that there's been such a brainwashing of physicians, in particular cardiologists. 80% of cardiologists take statin drugs. They are so convinced that these drugs are the wonder thing of the world. And it's not like the doctors are trying to push drugs on you. They're good physicians, they're good people. They honestly feel that these drugs will help you. And so because they care about you, they tell you, please take the drug, I take it too, and so on and so forth. And this marketing technique works so well that the #1 prescribed classification of drugs on this entire planet are drugs to lower cholesterol. #1. The drug companies pull in $20 to $30 billion a year worldwide on the sale of these drugs.
Over the years, have you found that there are other people like yourself, health professionals, who have the same points of view?
Very, very few. There's a doctrine out there. Take cholesterol. You should take cholesterol. Don't take any risks. You might get a heart attack or a stroke. One of the most common ailments that people get in their 50s and 60s is called atrial fibrillation, where suddenly your heart just starts going really fast. You might get 200 beats a minute, then your blood pressure goes up just out of nowhere. And they usually prescribe blood thinners for this condition so that you won't get a blood clot. But the minute a patient shows up, with this particular condition,